Yeah, that's right. All right, everyone, happy to start. Okay, well, thanks everyone for coming along this morning. Beautiful Melbourne day. I'm joined by the Minister for Health, Martin Foley, and also Professor Ben Cowie, who's the Senior Medical Advisor for the vaccination program. So in Victoria, we have 0 active cases. 13,291 tests were processed yesterday and 0 new community cases. Victorians have worked so hard to get us to this point, to the point where the numbers are very, very low. And critical to maintaining that success will be the successful rollout of the Commonwealth's vaccination program. Victoria, we started our program, the cohorts that we were committed to deliver on the 22nd of February. Slow and steady, a few sites, that's now grown over time, and we're now at a point where 129,537 Victorians, for the Victorians the government, the state government is responsible for, have been administered the vaccine. As I've said a number of times, as the Minister has said a number of times, every commitment that the Victorian government has made, every target that has been set for us, we have met. Indeed, we've exceeded that target. By the 4th week, we would have 40,000 tests, vaccinations administered, and we exceeded well above that target. As long as we get the supply from the Commonwealth, we can meet the targets that we set, and we've said that all along. Today, what we're announcing is laying out our plan for the next phase of the vaccination rollout, and that includes a target of 300,000 tests by the middle of May. 300,000 doses by the middle of May, I should say. To help us get there, we'll have additional sites and new services, and I'll ask the Minister to expand on that in a moment. So we will deliver 300,000 doses by the middle of May. We need public confidence in the rollout of the vaccination program. A clear way you can deliver that public confidence is by having a clear, articulated and public target, 300,000 by the middle of May. But there is another matter I wanted to raise in regards to the vaccination program. We are concerned that there are disparities amongst the states in terms of states attempting to fill the gaps in the vaccination rollout. The important point I wanted to make today, in the lead up to National Cabinet tomorrow, is that we can do more. Today we're announcing the next phase in the rollout of our vaccination program. We're setting a target of 300,000 doses by the middle of May. But importantly, we can do more. We can broaden the program. But that's a decision of the Commonwealth, and the point I'm making today is that we need national consistency. That's why it's appropriate that that be discussed at National Cabinet tomorrow. So for example, under the cohort 1B, the federal government, the Commonwealth, are responsible for people aged between 70 and 79. They're responsible for people aged over 80. Now we stand ready and willing and able to broaden our program and help the Commonwealth with additional cohorts of people. But that's a decision, as I said, that the Commonwealth needs to make, and we need to make it in a nationally consistent way. It's not appropriate that depending on where you live around the country, you get a different approach in terms of the rollout of the vaccination. So it's an important point that we're making today. The next phase in the rollout, a very public target that we will report to in regards to 300,000 doses by the middle of May, but an important message that we can broaden our capacity. We can do more, but that's a decision of the Commonwealth, and it needs to be a nationally consistent decision. And that's why, as part of the discussion I'm sure that will occur tomorrow at National Cabinet in terms of the vaccination rollout, this should be on the agenda, and we put that offer out to the Commonwealth. I might ask the Minister for Health to make a few comments and go through some of the detail about the new sites, the new services, as we ensure that we meet the target of 300,000 by the middle of May, as we have met every target that we have set. We are on track, on time, in Victoria's responsibility for the vaccination rollout, and I might ask Martin to make a few comments now.
Thanks, Acting Premier. So a target of 300,000 for the Victorian government's groups that have been allocated under the National Vaccination Plan to the state to deliver is achievable. It's based on the projections that the Commonwealth supply for vaccines, both Pfizer and AstraZeneca, up until the middle of May. We've been given forward projections as to how vaccinations will be provided to the states, and based on those projections, we think that we can ramp up our delivery mechanisms and get those vaccines into Victorians' arms in that timetable and to those amounts. Back in late February, we started with an initial number of hospital-based hubs, which we've grown over the course of the last 7 weeks to the point where now, based on the projections that the Commonwealth have provided to us, we can expand that again. So in addition to the substantial number of hospital hubs, sub-hubs, outreach groups to public residential aged care, and the multiplicity of delivery arms that we've got out in the field now, we will be announcing today 2 further Maxim large vaccination distribution hubs, one at the Royal Melbourne Showgrounds and one at the Mercure Convention Centre in Ballarat. And we'll have more to say about those as they are established in coming days. We're also announcing, as part of our 1B category of Victorians allocated to us in the vulnerable groups, the homeless, public tenants, those in insecure housing, we're announcing with a coalition of community health providers and specialist providers an outreach program to take vaccinations to those high-risk groups. There'll be a number of mobile vans and a number of community health centres establishing in and around those communities, high-rise estates, public housing estates, areas where we know homeless and other at-risk housing groups are provided for, to get the vaccines to those people. And those will roll out in locations such as Paran, Lilydale, Broadmeadows, West Melbourne and Deer Park in the coming days and weeks. As the Acting Premier has indicated, we know that this is a really significant project for the country. Our vaccination program requires a level of logistical and intergovernmental cooperation that we have not seen in the country's history when it comes to medical issues. This is a contribution to that. As the Acting Premier has indicated, Victoria stands ready, willing and able to go beyond that, but that needs a level of cooperation, a level of certainty of supply and a level of forward planning that I think all the states in the Commonwealth are capable of bringing. And as the Acting Premier has said, National Cabinet tomorrow gives us the perfect opportunity as a nation to come together to put this really important project front and centre, taking into account all the issues that we've had over recent times as a country, and build and deliver this project. So I might leave it there, and I think between the Premier and myself and Professor Cowie, we're happy to take any questions. So we can't speak for what the Commonwealth's contribution in 1A and 1B groups is doing. The Commonwealth have now indicated a desire to be more transparent in their delivery of information, and it's now up on the Commonwealth's website globally as to what they do in different settings. But to the best of my knowledge, to the best of my advice, that's not broken down state by state. It's a generalist figure. Look, we are in regular contact with our colleagues at the Commonwealth level and we regularly seek updates on those, but I can't tell you what the public figure for the number of vaccines that the Commonwealth has delivered, whether it be through disability, private residential aged care, or those groups. There's a number of people, fortunately, who make a process of making sure that they interrogate that data. That data is available from the Commonwealth in terms of the number of GPs nationally that have reported, but I can't tell you how many Victorian GP centres have put vaccines into people's arms, or how many the Commonwealth have put in for disability, private residential aged care or others. The Prime Minister's indicated that he's very keen on transparency of that information. We welcome that, and that's why, as the Acting Premier said, we're very keen to add to that transparency by us setting ourselves this 300,000 target and reporting against that as we go. I know the right hand and the left hand talk every day, literally every day, between the Commonwealth and the state. There are allocated groups under something called jurisdictional implementation agreements for the vaccine. These are Commonwealth-led documents that say this is what the Commonwealth are responsible for, this is what the state's responsible for. We then get allocated in advance, and at the moment that advance allocation is up until the middle of May, suitable number of vaccines to meet that obligation. Now, there's been a few bumps along the way, as we've seen over recent times, but we think now is the time, as the Acting Premier has indicated, to have that national conversation about, is there a better way to do this? I'm very curious to know. I am very curious to know that, and I ask on a regular basis. I don't get an answer. I don't get an answer. What I get is a global figure that the Commonwealth have delivered, or that GPs have delivered around the country. So under the allocation as it exists today, Victoria's been allocated 2 million Victorians under the national agreement to vaccinate in those groups. Our plan, our objective, is to meet the national target to get that done by the end of October. That will require a ramped up program of delivery and certainty of supply. And what our plan for calling here is that we think we can get to 300,000 based on what the Commonwealth tell us they'll deliver by the middle of May. And as the Acting Premier has indicated, we'd be very keen to think about other better ways to do things beyond that figure. I know I'm in daily almost contact with the Federal Health Minister. I've got a very good working relationship with Minister Hunt. All the health ministers work in a remarkably collegiate way, as you would expect in a global pandemic. We've got another meeting this evening, and what we do is we work in partnership to deliver vaccines that are provided to us. Victoria can only deliver what it's provided, and we think we can set ourselves a short-term goal of 300,000 by the middle of May based on what we've been allocated. That, as the Acting Premier has indicated, will give us a target, and it will hold us to the community to report back to the community as we go. But it is all subject to getting the supply. Oh, look, the Commonwealth has data, and it provides it on its website. We'd all like more granular information, and I give the Prime Minister and Minister Hunt due credit. They've indicated that they're very keen to provide more transparency. So we look forward to that transparency. This is not a time for semantics. This is not a time for one level of government to be taking issue with another. This is a national pandemic. It's a global pandemic that requires all levels of government to cooperate. Well, it varies, but over the course of both the 1A and 1B, I think we're aiming for it will go beyond the 16th of May or that week, but we're aiming for about 544,000 people in 1B and about 70,000 in 1A. So times 2, because you've got to have 2 doses for everything. So we're expecting that past the middle of May, that the Commonwealth will be able to provide us that certainty to meet that number in the short term.
I just meant as of now, so there's 129,000 administered. How many have been received as of now?
So this is one of the issues. Delivery of supply has been patchy, and for very good reasons, as the Federal Minister and the government have made clear at a national level. International supply is challenging, and as a result of that, some of the forward projections as to what we've been told that we would be provided vaccines are sometimes a little bit late, but at the moment we run pretty close to the line as to how many vaccines are coming in and how many are going out. We keep a little bit back just for contingencies, but not much.
Do you know how many?
I do have, I don't have that figure on me, but I can definitely get you precisely that figure as to what we've received from the Commonwealth. It goes up and down. Sometimes the schedules vary a little bit, but more or less we get what the Commonwealth have allocated to us. You might well. Always handy to have a professor.
Thank you. So what I can say is that the allocation, so we're currently in week 7 of the program. My understanding is that our allocation from the Commonwealth this week was just under 40,000 doses. Unfortunately, I don't believe that they've been delivered as yet, so we're still waiting on the delivery of those doses. And this speaks to what the Minister was saying, that clearly having forward knowledge of how many doses are arriving and when they're arriving is really important when trying to scale up both a sustainable and an efficient system. And so exactly as the Minister was saying, we're committed to working with our Commonwealth colleagues to having a better idea going forward of the number of doses and when they're arriving. But it was 40,000 allocated, or just under 40,000 for this week. Yeah, so I can certainly speak to the fact that there are some doses that are held in reserve. Those reserve doses are essentially to try and cover the situation when we don't receive the allocation on the date that we expect. We don't want to cancel any appointments of anyone who's booked into any of our state-supported system. And as a consequence, we do need to have that reserve, but we're committed to, as the Minister said, achieving the target of 300,000 vaccine doses administered by mid-May. And that will see us run down significantly the reserve we've got, but we do need to retain some reserve. Look, I'm really happy by 300,000 with mid-May. I think as the Acting Premier's already mentioned, at this point in time we're ahead of where we expected to be. We've met all the targets that we've set. I think that clearly there is more capacity, that we could potentially deliver more, but I'm just so impressed with our health services and our hospital immunisation hubs and now all the other health services, including the high throughput sites that Minister Foley was referring to. The amazing job they've done at setting up the sort of capacity that they have, but we have more capacity, and with more doses we can deliver more vaccine. But that the supply of doses of vaccine, and as Minister Foley was saying, assurances on when they're arriving and the distribution of those doses is really important to set up a stable system. But yeah, I'm definitely happy with 300,000, and we can do more.
So if we can do more, how many would you like to see, like May 16th?
I'd be really happy to see 300,000, as has been mentioned. But I think, as Minister Foley has clearly said, and also the Acting Premier, we're committed to working with the Commonwealth, and certainly, as Minister Foley was saying, we're in contact with our Commonwealth colleagues every day. Oh, no, I'm not going to be drawn on that. We do have additional capacity, but as you'd fully... well, what I was going to say was to actually be able to utilise that additional capacity, that's not just a question of turning on a tap, it's a question of training workforce, employing workforce, having the space available. This is an immense public health challenge. I think, as Minister Foley said when the program was launched at the Austin Hospital back on the 22nd of February, this is the largest public health exercise that Australia's ever undertaken. And so the arrival of extra doses is a critical part of that. But furthermore, we do need advance warning to be able to dial up the capacity. Well, that would very much depend on what we are told about their supply of doses, because it would be clearly an inefficient and also a waste of resources to scale up to maximal capacity, including hiring all the staff and creating all of the clinics, if the doses aren't going to arrive. So to be clear, 300,000 is our target. That's been set for the middle of May. I'm very happy with that figure, but we can work with the Commonwealth to do more should that be required.
So how would you describe the process?
The process of...
Like with the federal government and the communication and
Yeah.
the rollout?
Thanks. So in terms of the process, we are in daily contact and multiple times a day at multiple levels with our colleagues in the Commonwealth, and we're working very closely with them. As Minister Foley has also mentioned, he is in contact continually with the Federal Health Minister. So there's high degrees of contact. I think, as Minister Foley has mentioned, there are some areas which the Commonwealth have identified they would like to improve, such as the data and the reporting and the transparency around that. And we're committed to working with the Commonwealth on that. So I think we're working closely together. This is a challenging situation, but we are committed to working together to achieve the best possible outcomes for Victorians.
So the actual coronavirus waves affect different parts of the city disproportionately. Is there a push to make sure that those parts of the city may be vaccinated earlier or are vaccinated ahead of time, where there might be more risk demographically?
Yes, look, absolutely. And that sort of the dimensions both of risk, so underlying risk of COVID-19, and equity of access to vaccination are points that Minister Foley made earlier. And that's part of the reason that, as Minister Foley has already announced, we're really excited about partnering with a range of community health centres to deliver vaccine to some of the communities who may have lower degrees of access, certainly through the primary care rollout at this point in time. I'd like to really recognise that many of our community health centres, the nurses, the doctors, the bicultural workers, the health concierges who made such an important contribution to our response to the second wave of COVID-19 in Victoria last year, they were a fundamental support for those communities. And I'm really excited that they're going to be part of this next phase of our response to COVID-19 and be vaccinating those communities to prevent transmission and prevent the consequences of COVID-19 in the future.
What do you mean by lower access to the primary health care network? Are there parts of the city that don't have as many GPs for vaccines?
So we are working with our Commonwealth colleagues on that issue. We are assessing the number of doses available by local government area and by sort of across both Melbourne and the rest of Victoria. There are some areas where we believe there are less doses per head of population through the current distribution in general practice than other areas. We are working with our Commonwealth colleagues to ensure that in future rounds of GP allocation that those equity issues are very much front of mind for both us and our colleagues at the Commonwealth. But I think picking up on that point, the Minister's already mentioned the collaboration of these community health centres is one of the steps to address inequities in access, and we will keep an absolute focus on that because, as you say, COVID-19 wasn't evenly distributed across the community last year. There were areas of our state, and particularly of Melbourne, and there were communities who were disproportionately affected, and we must absolutely ensure that they've got the highest levels of access to vaccine as we can ensure.
Oh,
sorry, me. Sorry.
I just need to be close to
I'm sorry. Do I need to move?
Work as well. Is that enough if I just go like that? I'll check the levels. It just doesn't like.
Sorry, everybody. I probably caused a problem with my positioning. I apologise. So I wouldn't say it's a common occurrence. The allocation of vaccine that Victoria was expecting is delayed. This is exactly why, as I mentioned before, we have some reserve to ensure that the last thing we want to do is to have people make appointments to get vaccinated and then not be able to get vaccinated. That would be disastrous. So we do have some reserve to be able to ride this through. We can also load share across our system so that areas that are needing more vaccine, we can allocate that in a very timely fashion. Our health services are all working together so closely, and our local public health units are doing a great job coordinating that amongst them and with the Department of Health. So yes, there are occasions when, and this is one where we didn't get the vaccine that we expected. We are assured that it is coming and that we will certainly get all of those doses and potentially a few more. But this is why we've got that reserve, to be able to ride out those bumps and troughs.
So how are you going to reach that target of 300,000 doses if the allocations just keep not showing up?
So I'm certainly not trying to suggest that this is something that keeps on happening. This is something that we're dealing with right now, and we're obviously in contact with our Commonwealth colleagues to work out any issues that we can help support in the distribution network. It's, as Minister Foley and I believe the Acting Premier also said, the target is dependent on arrival of doses. We can't administer vaccine that we don't have. So the 300,000 target, we believe, is a sustainable, it's a reasonable target. It's a fantastic number of Victorians to have doses of vaccine administered to, but it is dependent on supply of vaccine, and we'll work with our Commonwealth colleagues to try and iron out any problems that continue, if they continue to happen.
So allocation doesn't show up a week later, a week later, a week later. What is the plan B? Where are the reserves coming from? And is there a possibility that we're not going to reach that target?
So clearly, and I'll sort of make this point again, the doses, so both the purchasing of vaccine, the allocation of vaccine to states and territories and through other networks, including our fantastic GPs here in Victoria, is a matter for the Commonwealth. We are certainly confident, we're assured by the Commonwealth, that the local production of AstraZeneca vaccine right here in Melbourne at the CSL facilities is going to ease a lot of the supply constraints. These are international constraints. It is something that our Commonwealth colleagues are facing every day, that they have not received, and this is a matter of public record. They have not received all the doses that they expected to from the international deliveries that they had ordered. And that's clearly something that is of concern, and they are keeping us briefed on those issues. However, that's why the local production of AstraZeneca has been assured, so that we can resolve that international supply constraints and supply locally manufactured and locally distributed vaccine for the rest of the country, which is exciting, and we really look forward to that coming into the system in greater scale.
Produced AstraZeneca vaccine, is it by now being transparent and telling us how many doses are being pumped out of the factory week by week? They haven't yet reached that target of 1 million doses. How do we expect to rely on that production?
So again, the number of doses coming out from the facility that have been purchased or ordered and purchased by the Commonwealth is really a matter for the Commonwealth, and I'm not able to speak to that. But what I can say is that we're assured by our Commonwealth colleagues that that production will be forthcoming, and really, honestly, we don't have any other alternative in Australia. We're in a very fantastic position. There's not many countries that have local production of vaccine. We're very fortunate that we do, and it's right here in Melbourne. And we're confident that that supply will be forthcoming, and it can't come soon enough. We're really looking forward to it. Yeah, so look, I obviously can't be drawn on the individual health circumstances of that person, other than to say we wish him all the best. He's in the expert care of our colleagues at Eastern Health. He can't be in a better place than the Victorian Public Health System. We obviously wish him and his family well, and I'd refer any questions regarding his status to Eastern Health.
Acting Premier, you referenced a discrepancy between states. Could you elaborate on what you meant by that?
Yeah, I mean, we had New South Wales yesterday also setting a target for their cohort that New South Wales is responsible, but also putting on the record that they'll be opening a max vaccination hub, and that they can take up to 60,000, I think was the figure that New South Wales spoke to yesterday. The point I was making is that states and territories can do more. We can do more. We've got the capacity, but it's a Commonwealth decision to broaden the cohort, and that needs to be nationally consistent. It shouldn't be dependent on whether you live in Victoria, New South Wales, or any other part of the country. The vaccination rollout should be exactly the same. So if the Commonwealth want states and territories to do more, they should take that to National Cabinet tomorrow. And the point I'm making today, the point New South Wales have made, is that we're ready, willing and able to do more. But that's a decision of the Commonwealth, and the point I was making is it must be nationally consistent.
So what the Prime Minister has said.
Well, that would be a decision of the Commonwealth, and that's why I want to encourage that discussion at National Cabinet. The example I gave you earlier was, for example, the age cohort of 70 to 79 or 80 plus. It may be that the Commonwealth wants additional help from states and territories to administer the vaccine to that cohort of Australians. We're ready, willing and able to broaden our cohort, but the rules are set by the Commonwealth. 1A and 1B, those cohorts that Victoria is responsible for, is a decision that was made at a national level. The cohorts that the Commonwealth are responsible for is a decision that they made. What I'm saying today, what New South Wales have said, is that we're ready, willing and able to do more, but that's a Commonwealth decision and it should be nationally consistent.
Acting Premier, the Prime Minister says he wants to put vaccine data and transparency on the agenda of tomorrow's National Cabinet meeting. Isn't it a little bit late to be transparent with this information?
I welcome those comments, and you heard from the Minister earlier about the questions we're asking in terms of how many Victorians have been administered vaccinations via the Commonwealth's program. So more data, more transparency would be incredibly welcome. The next phase of our rollout, what we're responsible for, is a very public target of 300,000 by mid-May, a target that will report progress to, subject of course to not only supply but confidence in the forward supply of the vaccine.
Are you unhappy with the way the government's handled the vaccine rollout?
Oh, look, we acknowledge that there's been challenges and challenges of supply and distribution, challenges at a global scale. So as I've said before, as the Minister said just a moment ago, we're not in the blame game. We know that there are challenges. This is the biggest medical logistical exercise in the history of our nation. So it is very, very difficult. What we're saying today is that we have met every target, every commitment that Victoria has made, we have met. We will have a target of 300,000 by mid-May, but we can do more if the Commonwealth needs us to do more. Will that be, as I understand it, that's 1B?
Correct.
Yep.
Yes.
Well, that will be part of the 1B rollout. So part of the 300,000 target will be family members, household members of quarantine workers. I might get either Ben or Martin. Yep, great.
Thank you, Acting Premier. Thank you, Minister. Yes, so almost all hotel quarantine workers have had their first dose of vaccine. It's far greater than 95%. Obviously, new people are continuously being employed into the hotel quarantine program, so we're ensuring that they're vaccinated as they come in and are deployed into the hotel quarantine program. So yes, the vast majority of hotel quarantine workers and all those being currently deployed into hotel quarantine have had their first dose, and many have had their second dose, because as the 1A of the 1A, if you like, they were the absolute express focus of our initial rollout from the 22nd of February.
The question was, they don't go in to start their job at a hotel quarantine centre at all unless they've had it.
So certainly we're working with our colleagues in COVID-19 Quarantine Victoria, or CQV, to ensure that that is so, that all hotel quarantine workers have the opportunity to be vaccinated and get their first dose before they're deployed into hotel quarantine.
But that previous question was whether or not that quarantine workers had at least that first dose 2 weeks prior to today, so that they could cover when they start their shifts.
Yeah. So we can give you a distribution of the timings. We can get back to you with those figures, but certainly, as I said, it was an express focus from the very start of the program on the 22nd of February. That included not just vaccination through other services, but actually reaching into hotel quarantine environments and establishing safe vaccination facilities to ensure that all hotel quarantine workers had access to vaccination, and that going forward, all workers being included into the hotel quarantine program as it resumes have vaccination in place.
So there aren't any workers that won't have that first vaccination, say 2 or 3 days ago?
So my understanding is that as I've said, all hotel quarantine workers are expected to have had their first dose before they're deployed into the program. The vast majority of those were vaccinated weeks ago. We can come back with further details over the timing and distribution in partnership with our colleagues at CQV to ensure that we're giving you accurate data.
Stripping away the supply chains, do you think that the state public health networks and the state public health infrastructure should have been more embedded in the rollout from day one? Would it make sense for the states that supply us with a big part rather than being the main driver of vaccine rollout at a public policy level?
So I think there were two parts to that question. The first was, to what degree was our public health infrastructure involved in the rollout of the vaccine? And obviously, I mean, the public health infrastructure is intimately involved in the rollout of the vaccine, both from a Department of Health level and also the use of our fantastic colleagues in the local public health units, which have really assuming, as well as hosting our 9 hospital immunisation hubs that got up and running from the 22nd of February, they're taking on a regional coordination role, so that they're able to see at the local level any areas of mismatch between doses and people needing to be vaccinated, etc. I think the second part of your question was more along the lines of the Commonwealth state question, and should Victoria have had a different role. I think it's already been put by both the acting Premier and by the Minister that Victoria stands ready to scale up our responsibilities in this space, including taking on additional cohorts. But even when you consider the primary care network, we are in continuous contact with representatives of primary care in Victoria. They're doing a fantastic job at scaling up and providing vaccine to a whole range of Victorians. We seek to support them in every regard. We've got formal consultative mechanisms with their representatives, and that's not just medically, but across the span of primary care. So I would argue that we are actually very closely integrated within the Victorian environment with both our primary care colleagues and of course our state supported services.
Well, the first thing we did was the extensive review of the program, both in terms of Professor Cheng and his work around the variant strains of coronavirus, and then the intensive work around ventilation and the work that needs to be conducted in each of the hotels to ensure we have the very best ventilation. And that's another thing that we'll be prosecuting at National Cabinet to get national consistency around those ventilation arrangements. So we have done everything we can. We have left no stone unturned to make it as safe as possible. No quarantine system in the world is zero risk, and I've said this a number of times, but I'm confident that we've done all that we can to make the program as safe as possible through those 2 reviews, as well as the continual oversight of Safer Care Victoria. No, it's very. There needs to be exclusive work at their designated hotel. That's the contract arrangements in place. We've been very, very clear about that, and I understand Minister Pearson has responded to those queries. Well, Richard, the answer to that question is we'll respond based on public health advice, as we have always done. We're continually reviewing and improving our contact tracing system. We respond to public health advice, and you've seen that around the country. In Queensland, New South Wales, WA, if there has been an outbreak, there's a quick circuit breaker lockdown. And that has been successful right across our nation. So we'll respond as we have for the last 14 months or so, based on expert public health advice.
The company Healthcare Australia, which runs hotels and hotels, the CEO's been stood down after Greg Hunt personally his office investigated the company and found out that they lied about the accreditation of a doctor in Queensland who administered and overdosed the vaccine. The company was approached by WorkSafe a few weeks ago because workers at the office realised that people were moving between hotels and the head office and between hotels and between other websites as well. There's been probably
Well, I'm happy to Minister Pearson to come back to you in detail and respond to those questions. What I've said is we've got very, very clear contractual arrangements in place, very strict arrangements that people are to work exclusively in one hotel, not to move around. We've got systems in place to ensure that that is the case. But in terms of the further detail to your question, I'll ask Minister Pearson to come back to you.
Doesn't it bother you that there is continued, month after month, continued evidence that they are not following those rules and that they are a private company which has at its core a profit motive rather than a public health motive?
Look, we've got very, very clear, very stringent arrangements in place. We have done all that we can to make sure our quarantine system is as safe as it can be. The reviews, the Safer Care oversight, Safer Care Victoria oversight of the operations of CQV go directly to the question that you've raised. We've made it very clear. The contract is absolutely rock solid. You can only work at one hotel, and that's our expectation. And we've got systems in place to ensure that that is the case.
At any point in those reviews, has the government looked at the company and its appropriate?
I'm happy to come back to you.
Is there financial penalties for those
I don't have the information in terms of the contractual arrangements, whether they're financial penalties or other, in terms of any breaking of those arrangements. So, Richard, I'm happy to come back to you on that.
Should the contract be torn up if the late
Well, I'm not going to get into hypotheticals. It's clear what the arrangement must be, what the contract says must happen. We've got very clear oversight of these arrangements through CQV, and we will ensure that that is the case. We cannot have staff working in multiple sites, and the contract makes it clear that they must not work in multiple sites. Oh, look, I think that's the appropriate call that Victoria Police have made to get to the bottom of why the fire occurred. So to take the fleet off, to disconnect the signage. I think that the reports are that the signage was the cause of the fire that recently occurred. Importantly, alcohol and drug testing will continue via police operations through their mobile services. But importantly, we need to get to the bottom of this, and that's exactly why VicPol have made that call.
What do you make of this satellite roadside testing, though, given it used to be what I period is traditionally one of the worst on our roads? Will they be able to conduct as many roadside tests as they would hope to during this time?
Yeah, I mean, you'd have to put that question to VicPol in terms of their operational arrangements and the numbers that they're to meet. But what they'll do is ramp up their mobile operations whilst the buses are offline and undertaking these investigations.
Victoria's worst COVID outbreaks have been linked to our aged care proceedings, but not all of the staff at these facilities have received COVID jabs. Are you worried that the restart of the quarantine program will leave these facilities at risk?
I might refer to either Ben or Martin in terms of the rollout with aged care.
So you're right, private residential aged care saw tragically the loss of far too many lives in 2020, both in Victoria and around the country. That's why it's a priority group in the Commonwealth's 1A rollout. So you'd have to direct your questions as to the levels of vaccination in those private residential aged care for staff to the Commonwealth. I can happily report that in public residential aged care that we are more than confident that we will deliver full coverage of both staff and workers within our 1A group on schedule, and we'll land that. They've all had at least their initial one, and we'd be more than confident that over the coming weeks, as the clinical guidance is for when you can get your second vaccination, that all public residential aged care staff will be fully vaccinated.
Is there a stage where the state might have to step in and help vaccinate those staff at these private facilities, given that we've got international travel back?
Well, as the Acting Premier has indicated, Victoria stands ready to assist the Commonwealth in a consistent national approach. We don't want to put any preconditions on anything that's going to improve the biggest public health logistical exercise in the country's history. We're inviting, as indeed are other jurisdictions, inviting a frank discussion as to how can we do this better. That's one particular area. The GPs are full of creative suggestions as to how things could be done better. The states have been in the vaccination distribution business for over half a century. They have established capacity, established systems, nothing like this current rollout of the scale, but we can work cooperatively with primary healthcare providers, cooperatively with the Commonwealth, cooperatively with the community health sector, and together all levels of government and community can deliver this. As the acting Premier has indicated, Victoria stands ready, willing and able to talk about new ways to do this, all subject to the provision of more supply.
There's another COVID outbreak in Victoria. Would the state step in at that stage and vaccinate those populations under Commonwealth responsibility?
Well, by definition, if there's a COVID outbreak in any part of the community, we would respond on whatever the public health advice is. The object of the exercise of 1A groups, the most at-risk groups, is to target those people to avoid that particular possibility. And that's why, whether it's the disability community, whether it's the private residential aged care community, those are questions in terms of where they're up to. You'd have to direct to the Commonwealth, but we stand ready to assist in a multitude of areas subject to supply.
Would Victoria be open to releasing information on the daily number of doses received and used?
Well, we don't receive doses daily. We receive them in a relatively ad hoc weekly basis, and as Professor Cowie's indicated, we were expecting some delivery last week. It didn't show up for this week. We're assured it will come, and we have every confidence it will come. I've sought and gained commitments from the Commonwealth myself as to that, and I thank the Commonwealth for that. So it's a bit hard to release daily figures that you don't have. But in terms of what we deliver, we already do publish daily on our website what our vaccination rates for the day before are. And if there's further measures that can align the two for the sort of transparency that the acting Premier was talking about, we'd welcome that. Well, in terms of material that we've received, because of the forward projections that we've indicated that we think we can get to 300,000 by the middle of May, that by definition is based on good faith understandings as to what the Commonwealth will deliver for us. In terms of we can't really publish what we think we're going to get. We can project on that, and we have every confidence that we will get that material, but it's up to the Commonwealth, and I think that might well be one of the issues that the Prime Minister might well be bringing to the table tomorrow when he talks of transparency.
Will you be pushing for that, to be able to publish the vaccines that the Commonwealth provides to the
Well, in terms of what transparency the Commonwealth want to bring to the table, that's really a matter for them. But as Victoria has indicated today, by setting ourselves targets, by reporting against them, we welcome any measures that improve transparency of supply and distribution to give Victorians the confidence that they can safely and predictably get this vaccine as a mechanism to get us out of this global pandemic. It's all about building community confidence. And if more transparency builds that community confidence, then we welcome that.
Really fruitful discussions and actions that we've taken. So my department, my office have been engaging with Chanel Contos for a number of weeks, and we've made the announcement that in term 2 there will be mandatory consent education in our schools. So we've already got the best framework through Respectful Relationships curriculum. We're going to ramp that up and make consent education compulsory in government schools at an age-appropriate level as students go through their education. That'll be from the start of term 2. We're working with Chanel, we're working with my expert advisory group on our respectful relationships curriculum in terms of what changes we need to make, resources provided to school. But this is a significant announcement that we've made, and I'm really excited about it.
But Janelle says that Victoria's reporting of sexual assault isn't quite up to scratch. So why was no one from Labor at her convention?
So there's a couple of things on that question. There will be, as is standard practice in the Parliament here, we have government MP briefings and opposition and crossbench briefings. So we'll have engagement with government MPs in terms of what we're doing with Chanel. But the point I wanted to make is that we have taken action. We've worked with Chanel over a number of weeks, my department, my office. We've already announced changes, and I'm not going to be lectured to by the opposition. You know, there are people in this chamber, in the Liberal Party, that publicly oppose respectful relationships, that publicly oppose the announcement that we made that consent education will be compulsory in secondary schools. I'm proud of the actions that we've taken. In a standard way, there'll be a briefing for government MPs. At the same time, my colleague, the Minister for Workplace Safety, we announced a ministerial task force on workplace sexual harassment. That task force will report back to government later this year, and we've asked them particularly to look at the issue of mandatory reporting of sexual harassment in the workplace. And I'm looking forward to that report and responding to that report.
Janelle started the presentation with a slide that said address to Victorian Parliament.
Yep.
She opened by saying Labor has chosen to have these sentiments separately, but to me it's not a political issue, it's a human rights issue. So why is Labor
And she's, no, Chanel,
45-minute address when they could have just tuned in this morning and put aside politics?
Chanel is exactly right. This is a human rights issue. The only point I'm making today, it's standard practice in the Parliament. The government MPs get a briefing, opposition and crossbench MPs get a briefing. That's the standard way we approach members of Parliament being provided briefings on issues. The important thing that we've done is work directly with Chanel over a number of weeks, my office and my department, and have taken action, including making consent education mandatory in government schools.
What Janelle wants is reporting of sexual assault that can be anonymous, similar to what she did in New South Wales with Operation Fix. How is Victoria going to work towards that?
Well, I'm always positive about looking at ways that we can improve, and you know, the specific question of mandatory reporting of sexual harassment in the workplace has been given directly to the ministerial task force that we announced around a month ago. So we're taking action. You know, this is a significant national issue, and Victoria is doing more than any other jurisdiction in this country, including the Commonwealth. The Ministerial Task Force on Workplace Sexual Harassment, mandatory consent education in government schools, the rollout of respectful relationships, which was one of the key recommendations of the Family Violence Royal Commission, respectful relationships from prep right through to year 12 in all our government schools and in a number, hundreds of non-government schools, and I'd love to see that figure even go further in our government schools. No government, no jurisdiction is doing more than Victoria is in this space.
But that's not true in the case of empowering victims to actually report their assault in the first place. New South Wales is seemingly making it easier by allowing people to jump on the digital form and do that anonymously. Is Victoria considering something like this?
Well, I'm not making any further announcements today, but what I am saying is that we're taking action. If there's more that we can do, of course we'll look at doing that. But no government, no jurisdiction is doing more than Victoria in regards to sexual harassment, sexual assault, inappropriate behaviour, education of our kids in schools. And I'm not going to be lectured to by the state opposition, by the Liberal Party, who publicly oppose what we are doing in terms of talking to our kids about consent. There are people in that mob that oppose it, and I'm not going to be lectured to by them.
So when is your next briefing with Chanel? When is Labor going to hear this 45-minute discussion about it?
So we've been in regular contact with Chanel over a number of weeks, as well as my ministerial advisory group on respectful relationships, and we'll continue to work with that expert advisory group with Chanel in terms of what we are doing in our school system that no one else is doing. No one else is doing this. No one else is making consent education mandatory. Victoria is, and I'm really proud that we're making that decision.
With consent aside, when are you going to speak with Chanel about the rules that needs to be improved in Victoria? The opposition have heard it this morning, the Greens have heard it, independents have heard it. When are you going to talk specifically?
I'll keep answering the question, and you can keep repeating the same question. As is standard practice, government MPs get briefed on issues, opposition and crossbench MPs get briefed. So there'll be a briefing for government MPs, but importantly, the government is taking action, unlike every other jurisdiction in this country.
When will that briefing be? There are women out there right now who aren't reporting their sexual assault because they don't want to rock up to a police station and have to do so.
The briefing is occurring shortly, as I understand.
The Commonwealth blocks economic cohorts coming in as part of suggestions there. Is that the only way to bring in international students? Could you go and submit a different plan that is not part of that 1,200 or 1,000, whatever our intake is? Are you considering universities offering international?
So we continue to pursue this issue. As I said in a previous doorstop, the first hurdle is getting agreement via the Commonwealth to have a proportion of travellers, returning travellers, being economic cohorts. So that's the first hurdle, and we're going to continue to pursue that. We want to see international education return. We want to see other economic cohorts returning to our state, whether it's film crews, whether it's skilled workforce, doctors and other healthcare workers. We want to see those economic cohorts return. We want to see it happen as soon as it's safe to do so. The first hurdle is getting agreement from the Commonwealth to allow for those economic cohorts to return, and that's why we'll continue to work with the Commonwealth. We'll continue to work with universities. We want to see this sector return, and we want to see it return when it's safe to do so. Because that is a decision. So you go back to first principles. The decision is whether to open the flights that return into our country, allowing for some economic cohorts. That's what we are arguing for, Richard. Now we did. Yeah. And that is why we're not closing the door on this issue. We're going to continue to advocate to the Commonwealth about economic cohorts being able to travel to Australia, and we'll continue to work with universities and others, whether it's international students or whether it's other economic cohorts. We want that to happen, and we'll continue to work with the Commonwealth.
Tennis players weren't ticked off by the Commonwealth as part of the regular intake as economic cohorts. That was a separate stream.
It was a separate stream, but an acknowledgement that was a significant event, both culturally and economically, for our nation. So yes, there was a Commonwealth agreement to allow that to happen. What we are arguing for is that there are other elements of economic activity, other cohorts that need to travel to Victoria and other parts of our nation. So New South Wales, South Australia, ourselves, we're advocating for the opportunity to have our economic cohorts travel to Australia.
Have you made a decision about the location of a mass quarantine
So the business case has been finalised, as we have said. That was to be finalised by the end of last month, so that work has been completed. We're now considering that report. I don't have any announcements to make today, Andrew, but we'll be coming back to you once government has made a decision.
Will you be bringing up the issue of international students at tomorrow's social?
So we're constantly talking to the Commonwealth about economic cohorts. So whether that's on the agenda tomorrow, there'll be a number of things on the agenda, vaccinations, sexual harassment. So we'll continue to advocate to the Commonwealth.
Given that you've got this plan that's been hatched by the major universities and it's so crucial to Victoria's economy specifically, is it tomorrow the perfect time to bring it up?
We continue to advocate to the Commonwealth around economic cohorts, and we'll continue to work with the Commonwealth, work with universities and others about the best way to provide that opportunity and get Commonwealth agreement. The first hurdle is for the Commonwealth to say, yes, we can get economic cohorts as part of our framework for flights returning to Australia.
Why does the federal government seem to not be playing ball with Victoria, given that it seems New South Wales is pressing ahead at the moment with bringing back international students? I've read today they're pushing for the return of 10,000 students this year and speaking to accommodation providers at the moment.
Well, pushing for is pretty much the same as advocating for. That's what New South Wales is doing. That's what South Australia is doing. That's what Victoria is doing. I don't have any announcements to make. We'll continue to argue for economic cohorts being able to travel to Victoria.
Are you speaking to accommodation providers?
I'm not going to go into detail in terms of who we are talking to. I'm making the point that we're advocating to the Commonwealth. We're talking to universities and others about economic cohorts. We want to see international students return. We want to see it return when it is safe to do so. All right, thanks all.